The blood consists of different types of cells. When these cells stick together in a clump, a blood clot forms. Occasionally blood clots are helpful, like when you cut yourself and the blood clots at the wound to stop bleeding. But when blood clots form inside your veins and don't break down, or if your body produces too many blood clots, it can be incredibly dangerous. Blood clots can prevent blood flow to key organs in your body, leading to life-threatening situations. There are two types of blood clots that are the most common. Deep vein thrombosis (DVT) is a blood clot that develops in the deep veins in your legs and sometimes your arms. Pulmonary embolism is a DVT clot or part of one that has traveled into your lungs. When blood clots form in blood vessels in other parts of your body, you can experience a heart attack, kidney failure, or a stroke. Risk factors for blood clots. About half of all blood clots occur right after, or even during a hospital stay for surgery. If you know you are at risk for blood clots or have a history of blood clots, let your doctors know this before any medical procedure. Other risk factors for blood clots include age, cancer and cancer treatments, such as chemotherapy, certain genetic conditions, COVID-19 diagnosis, diabetes, family history of blood clots, hormone replacement therapy and hormonal birth control use, long periods of seated travel, such as international flights, obesity, pregnancy, smoking. Warning signs and symptoms of blood clots. The signs of a blood clot will vary depending on where in your body the clot is. Often, blood clots will have no signs until they cause a pulmonary embolism. Sometimes a blood clot in the leg will feel like a pulled muscle, while one in your lung may feel like someone is sitting on your chest, preventing you from breathing. A great way to remember the signs of a blood clot is by using the acronym STOP. The clot: swelling in the leg or arm, tenderness or cramps in the leg, out of breath or shortness of breath, passing out or feeling lightheaded, chest pain or back pain when breathing, leg discoloration, either a red or blue hue, overdrive, when your heart is racing, time to call the emergency. Other symptoms of DVT include your leg or arm feeling warm to the touch. Symptoms could also include coughing up blood. How to prevent blood clots. If you think you or a loved one may be experiencing a blood clot, it's important to get medical treatment immediately. It's also important to talk to your doctor if you think you are at high risk for blood clots. According to the Centers for Disease Control and Prevention, it is possible to prevent blood clots with the use of medications like blood thinners. Blood clots may also be prevented by exercising regularly, getting up and walking every hour if possible, on flights or other travel that involves sitting for long periods, losing weight, wearing compression socks or tights. Please share and subscribe. If you are experiencing a pulmonary embolism,